So I had, in the mental health sphere, two very clear cases. One was a young woman, 20 years old, going to multitudes of mental health professionals, even had a ganglion block, struggled terribly with PTSD based on her experiences with her father who had passed away, and everything that she was doing for herself was in the mental health sphere. Going to therapy more than once a week, comes to my office because I had treated her mom, and she brought her daughter, and this poor woman is always crying. And I was a little bit lost with it. She was quite fragile. And I said, let's check for reasons why you're this anxious. Let's do a Lyme panel. And we did find she had very active anaplasma, which I treated with antibiotics. She also had previous exposures to Lyme disease. And we don't know how long ago that was, but that certainly could have started this entire inflammatory cytokine cascade of undeniable, uncontrollable anxiety. And she had this whole picture of symptoms that was continuing to unfold. So she started to feel better. Within 2 months of meeting her, I had to put her in the hospital. I had to diagnose her with type 1 diabetes. She was going to mental health professionals, and she was cycling in and out of very high blood sugars, and she had no idea any of this was going on. And it was I had actually done blood work, and she wasn't diabetic at the minute that it was drawn. So it was coming in and out, which explained this kind of bizarre nature of it. Because she, for a little while, would do a little bit better, and the entire case unfolded in a very different way. And she felt as though, she couldn't have possibly understood chemically what was going on in her body. So for her mental health, I gave her antibiotics and insulin, not antidepressants or a ganglion block. So that was an amazing instance of somebody thinking it's one thing and it really isn't. Another case I had, the woman is stubborn is the nicest thing I can say about it, because she just didn't want to do anything but kind of counseling and some homeopathy, which I'm more than happy to do. So menopausal woman, very unhappy in her marriage. Very, very, very unhappy in her marriage, and revealing all of that to me. And you need support if you're thinking about divorce. And we're going on with it for months. Very busy woman, CEO of a big nonprofit, and just kind of keeping it all inside. She hasn't told her family she's unhappy in her marriage. And she has certain physical symptoms, because I'm never not going to do a physical exam. She has certain physical symptoms that I'm encouraging her, let's do some testing, let's check this out more. And she's just too busy. And we went on like that for probably 3 or 4 months. I would see her maybe once or twice a month. And then I finally ran a test, and she had active babesia, which is a co-infection of Lyme that isn't actually a bacteria. It's actually a blood parasite. It takes a completely different other treatment than Lyme disease. But it's very serious. And she said, another one who said it was all stress. It's the stress of this, it's the stress of that. And I'm begging her to, let's address your hormones. Let's check for Lyme. At the time I'm living in Vermont, all of us could have Lyme on any given day, honestly. So you always want to check when somebody has these kind of bizarre, unshakable symptoms. So she has babesia. I have to treat it. And the symptom of clenching her jaw, which she 100, and it was really painful. Clenching her jaw, she 100% attributed to stress. I treated her for babesia. For the recommended protocol, it was at least 10 days plus a weekly certain medication. It completely resolved without any other treatment. So trust me when I say symptoms can look like one thing, and they might be something else entirely, and they might be something very, very serious. So those two cases, type 1 diabetes does not go away. You could wind up in a coma. And babesia is a very complex, it's like malaria. It's a blood parasite, and it can, with lingering years, can advance into very deep organ disorders, that can affect your lungs or your liver. And you really want to keep up with that, because that can develop into chronic disease. So digging. It's like my favorite thing to do, right? I always check everybody's women's thyroids when they walk in, because if that's wrong, nothing's going to be right. And also anemia. Those two things with a comprehensive metabolic panel are usually my standard. And then listen to the symptoms, try to get to the bottom of it, build that bond and that connection, ask, pretty leading questions at times, and then start picking out therapeutics like homeopathy and supplements, wait for the tests to come back. And that's how we do it. And it can be very eye-opening, because I think so many people walk around undiagnosed, underdiagnosed, or misdiagnosed, particularly in mental health. In the adoptee community, people are diagnosed with things like reactive attachment disorder from childhood or something like this, ADHD. Every adoptee has some element, potentially, of PTSD or complex PTSD. No offense to how they were raised or anything like that. Adoption is a thing. It's a real thing. And you could be taking, again, the absolute wrong medication. And now we're having conversations about adverse childhood events contributing to children's behavior disorders. Well, I would put adoption in an adverse childhood event, potentially, category. Children don't know what's going on. But once they're old enough to understand potentially what's happened and they feel the need to talk about it, it can be very disturbing, creating, distraction, which can cause inability to concentrate, or even depression in a child, right? Or just confusion that leads to all kinds of behavior stuff. And it may or may not require pharmaceutical medication. So understanding that natural therapies too can be used in brain health / mental health can be very wonderful, because you could feel very empowered taking botanicals or a homeopathic remedy for your child rather than some pretty hard-hitting psychiatric medication that might be causing some side effects that nobody in the family really likes and is a little afraid of. So I have those options. Lots of experience with how to use. I only give things that I know work, and they work fast. I don't like to fool around, particularly with a child's mental health. So the experience there is, that's what you want to be doing. Not, oh, let me Google what homeopathic remedy I can give my child for nightmares. Because a retail item is going to be such a low potency, may or may not work. When you work with somebody like me, the specificity in selecting the best tailored medications, homeopathics, botanicals, saves time, it works immediately. Everything is better as fast as possible.